very important. So for some of you, this will be a review, but some of you are not familiar with the Alliance for Health Equity. I'm not going to read every detail on the slide. We will be sending out the slides after the meeting, so you'll have access to read this more thoroughly if you like. But the Alliance for Health Equity is a collaboration of health systems, health departments, and community-based organizations in Chicago and suburban Cook County, facilitated by Illinois Public Health Institute staff. The Alliance was started to support the community health needs assessment and implementation plans. The first CHNA was completed in 2016, and several work groups were created to address key priority areas, including food access, housing, mental health, and social and structural determinants of health. And so we are specifically the mental health work group, and that's the umbrella under which Systems in Sync resides. For clarity, I have a nice little diagram in the bottom right there because I know it's kind of a confusing tiered setup. So IPHI and our partners, hospitals, health departments, and nonprofit partners come together to form the Alliance for Health Equity. And then the CHNA, as you can see in that purple bubble there, is a trigger for us to have work groups that come out of the needs of the community that they express in the CHNA process, as well as the programming and improvement plans that our partner organizations are working on. And so you can see the mental health work group is in the center there. We also have a housing and a food work group, as well as some other miscellaneous work. And then Systems in Sync is a subset of the mental health work group. I'll get in a little more into the other things the mental health work group is working on in a moment. So this is a little history of the mental health work group. It was originally created out of the 2016 CHNA and had a set of priorities, as you can see there. And then after the next round, which was the 2019 to 2021 CHNA period, had some priorities. And some previous projects that the work group has done include stigma reduction training program for providers, having a mental health first aid subcommittee, some opioid treatment and response learning collaboratives, and faith community subcommittee, trauma informed hospitals collaborative, and an work on the 1115 waiver for Medicaid. And the mental health work group, as you can see, it ends at 2021. It did go into a hiatus for a while, but we relaunched it at the beginning of last year, 2024. And so here we are today. A few cross-cutting strategies that the mental health work group uses to help guide its work include fostering collaboration, advocacy and coalition building, leveraging community partnerships, social and structural determinants of mental health, racial equity, and substance use treatment and prevention. And then you can see a few of our priority populations there. This is by no means an exhaustive list, but just gives a few examples. And for this iteration of the mental health work group, we worked together to narrow down to two main priority areas, children and youth, including school-based services and young adults, and workforce development, including burnout prevention and support, and diversity in clinical staff through removing training and opportunity barriers. And so, let me get back. So given these priority areas and these cross-cutting strategies and the sort of goals of the mental health work group and Alliance for Health Equity overall, you can see where the Systems in Sync movement comes from. The idea came out of a mental health work group meeting we had where we had picked these priorities and we're trying to figure out actionable items we could do out of those priorities. And the thing that kept coming up from everyone was, I don't know what other organizations are doing. We don't know where work is being done so we don't totally know where the gaps are. Everyone feels very siloed and there's a lack of communication. So we decided to create this collaboration and partnership building initiative that we are calling Systems in Sync. And the event we had on September 18th was sort of the kickoff of that. And now today's discussion will be, where do we go from here? What is it that the mental health and substance use services community in Cook County and Chicago, what kind of support do you all want and need to help build these partnerships to help do your work? So before I continue on, does anyone have any questions so far on the nature of the alliance, the event, the mental health work group? We'll get into the event in a moment. Anything like that? Okay, and you're always welcome to put questions in the chat. We're also monitoring that. I know this is a lot of me talking at the beginning, but we'll get to the discussion soon, I promise. So our Systems in Sync kickoff event was on September 18th, and we had a really great showing, some really great presentations and panels and discussions. And throughout the presentation, we have a few quotes here that came out of the event. So if you see these quotes in little speech bubbles, that means it came from this kickoff event. So for example, Nanette Larson, who was one of our wonderful panelists, said, "It's really people-to-people connections that are going to be making a difference in the times we're living in." And we thought that was very relevant to this movement. We also have our wonderful co-hosts listed across the top, who were a huge support in putting on this event. And we have videos and photos. I know some of you in this virtual room are in these photos. So if you'd like to go to our AHE website, which Jess just put the link in the chat, you can see some photos from the event. You can see the videos of the presentations and the panel, as well as get more information and updates on Systems in Sync there. We keep it updated as we go along. And a big thank you to our photographer, Timmy Samuel, who did an amazing job. So the event, we had around 100 people who were in the room, including 10 tabling organizations, 9 program presentations, 5 community experts, and 4 panelists. In total, over 50 organizations were represented with the attendees. And that you can see the sort of sector division there on that pie chart. Our majority were community organizations, followed by healthcare, and then government health departments, school districts, and other were in the subsets there. And what were the goals for the event? The goals were to serve as a catalyst for partnership and collaboration in the behavioral health space in Chicago and suburban Cook County, increasing mutual awareness of behavioral health programs and initiatives across sectors and organizations, highlighting the importance of partnership and collaboration in the current political environment, and provide ongoing support and resources for behavioral health organizations, creating and strengthening partnerships. So we're really looking at that fourth one today, but want to definitely keep all of these in mind. And for those of you who are not at the event, we had our panel, Collaboration and Partnership in the Current Political Environment, and our lovely panelists that did an absolutely fantastic job, as well as our presenters from these organizations here, who also amazing job. Okay, I know this looks like a mess, but I promise there's a plan here. Presentations and panel themes that came out of the event. The 4 big themes that we picked up after reviewing all the notes and discussions in the videos were community expertise, the political climate, keeping things human-centered, and peer support. So again, I won't go through all of these quotes. They're just illustrating kind of how we got to these four main ideas. And you'll get the slides afterwards. So if you're interested, you can go through. And then after the presentations in the panel, we had our collaboration sessions. And so some notes that we got out of those, I know much more than this was discussed, but just to highlight a few notes, under our youth mental health subcategory, folks discussed resources for family unit, alternatives to hospitalization, how are providers approaching care coordination, mentoring, decreased barriers to care and support, and neighborhood level determinants. And then under our specific populations section, one main thought was, how do we find a way to connect to other population-specific and competent providers, thinking about intersectional identities? So those are a couple of insights we got out of there. Okay, moving on to the event feedback. This is based off of the event survey that we shared both at the event and I sent out through email. And actually, this 13 surveys, I did not update that. That's incorrect. It was actually over 20 surveys, so a little bit more feedback than it says on the slide, but the other numbers I did update. So we asked, how well did the event align with its goals, those goals that we discussed earlier or we saw earlier, and asked folks to rate it on a scale of 1 to 5, and the average response we got was 4.6, so feeling pretty good about that. Which parts of the event did you find most valuable? And we asked folks to select 2, and the top 2 selections were connecting in person and the program presentations. 45% also got things out of the thought the panel was very valuable, feedback from community experts, and then our collaboration sessions. And then if Systems in Sync was made an annual event, would you be interested in attending in 2026? We had 80% say yes, 20% say not sure, and 0% say no. So that also tells us that the event was helpful for people. And we also asked an open-ended question if there was anything you felt was missing from the event. And this sort of summarizing all the feedback we got. More feedback connection with experience of the community, more time for Q&A with presenters and government officials, more structure and guidance to the collaboration sessions, less rushed presentations, wanting more breaks, wanting a list of attendees with contact info to connect after the event, more presentations on current collaborations, and some professional development sessions. So those of you who were at the event and maybe didn't have time to fill out our survey, if there's anything you would like to add or agree with that I've covered so far in these results, you're welcome to either speak up or put it in the chat. If you thought you really got a lot out of connecting in person or the feedback from the community, or if there's anything else that you thought was missing from the event or that you agree could have really been useful that's already listed here, please do share that. Okay. So we're gonna move on, but again, the chat is always open. Now, this is what we're really here for today. How are we going to continue supporting these collaborations, these partnerships, and the organizations in general that are doing this work in Chicago and suburban Cook County to improve mental health. So on that feedback survey, we asked where we should go from here. What is it you're interested and think would be supportive for your work? And our number one response was occasional learning sessions about policy and funding, followed by a directory or listserv of behavioral health organizations and institutions. Then regular meetings and updates on behavioral health programs, a newsletter with updates on behavioral health programs, policy, funding, a variety of categories. Occasional learning sessions around collaboration and partnership building skills, joining the Alliance for Health Equity work group, which is always open. And then we had another option, and one suggestion was subcommittees within the AHE mental health work group that supports building out learning sessions, after work hour mixers for further networking, and a calendar of events so that we can go and attend to support one another's work. So what we did then was looked over this, got some feedback from other individuals that were at the event, as well as compared that to those goals of System in Sync and the priorities of the mental health work group, took all that info and feedback and kind of put it together and tried to come up with a way to move forward. Oh, and here's those goals and priorities that were used to help come to our proposal. So for our discussion, we have here a proposal for how, given all that information, we believe we should move forward. And we're looking to hear your feedback on, like, would this type of thing be useful? Is there something you would prefer more, or a specific aspect that would really be helpful to you? As well as we have all these things to think about that we'll be discussing, of how often things should happen, what specific topics. So to go over what our proposal is, a newsletter, the frequency to be determined, including sections on partnerships wanted, so opportunities for collaboration. Someone saying, we're applying for this grant, that's a partnership between the health department and an organization doing this specific thing, or we provide this service but could really use help connecting with schools or connecting with a specific population. Whatever opportunities for partnerships could be posted there. Funding opportunities, policy updates, program updates, an event calendar including learning opportunities, and events from various organizations and programs. And in addition to that, having regular meetings, again, frequency TBD, featuring learning sessions and in-depth updates on programs and policy. So sort of a combination. Let's say, for example, if we decided to meet quarterly, the one quarterly meeting might have an in-depth update on a specific program or a report that's released or a collaboration that's happening, as well as a learning session or a review of all the policy that has been updated, because we know that's coming out rapid fire these days. And so that's sort of like mixed topic meeting, but all focused around behavioral health. And so then we have a few questions on what to think about, and I do have an interactive way for us to do that, so you're going to have to participate a little bit. And I'm not going to read all these now because they're on the slides, but just as we're discussing these, try to keep in mind these goals of Systems in Sync, and especially these cross-cutting strategies here from the work group. Okay, Mentimeter. For those of you who are part of the mental health work group, I know you've used these before because I love a Mentimeter. We're going to put the link in the chat, or you can scan the QR code with your phone. If you're having trouble getting in for any reason, let us know. I'm going to leave that up for another 30 seconds or so. And thank you, Isabella, for putting the link in the chat. Okay, and then let me switch screens. And I see some of you got in because you're already participating. Fantastic. Okay, so you see the question here is, how often would you want to receive a Systems in Sync newsletter? And we have bi-weekly, which is every other week, not twice a week. I don't have time for that, sorry. Monthly, quarterly, and you have no interest in a newsletter, which is totally fine, but we need to know that if so. And it looks like monthly is, we're kind of even monthly and quarterly, so. And we will also keep this Mentimeter open because we know there are lots of folks who are not able to attend today, but we do want to get feedback to start working on things. Great, seeing some sort of monthly, quarterly up in there. And then what should the scope of this newsletter be? Do we want to really strictly narrow in on behavioral health, look at behavioral health in sort of directly related categories, maybe updates on unhoused populations or immigration and refugee situation? Or do you want to broadly look at public health, but keep it through a behavioral health lens? So anything that's in public health, but focusing on the behavioral health aspects of it. Going to give it another few seconds for folks to get their votes in. It looks like no one is interested in it being very narrowly focused on behavioral health, which is great because, as we all know, context matters and nothing is isolated. We're pretty close between behavioral health and directly related or a more broad public health through the behavioral health lens. Okay. And which sections, we're still talking about the newsletter, which sections would you be most interested in? I think I asked to rank these, so I'll give you a little bit of extra time to rank things. Um, and if there's an additional section that you don't see here that you would be interested in, please either put it in the chat or come off mute and share, because there could be something we've just totally missed that could be really helpful for the newsletter. Okay, we're going to give it another, I don't know, 30 to 45 seconds for the last couple folks to get their selections in. Okay, so it's looking like some of the top choices are policy updates and program updates. I'm not surprised by that. Learning opportunities, partners wanted section, and then followed by funding opportunities tied with event calendar. Other thoughts on the newsletter? This is an open answer section, so please express your thoughts. Is there something you're really strongly feeling that you want to see that either was or was not already discussed? Um, is there something particular about it that could be really helpful? Do you have examples of maybe other areas that do a newspaper or other organizations that do a newsletter that you think is a really good example of that we should take inspiration from? Any of that, just basically anything that we haven't already covered on the newsletter. Resources for agencies or communities. Oh, and one thing I did forget to mention earlier, um, there was a big desire for some sort of database or listserv of organizations. And so we are thinking about creating one of those and then would be linked in every newsletter. We wouldn't, of course, have, 15 pages of organization attached on, but probably hosted on the Alliance website or something like that. Um, More information about that will be coming. So brief highlights. I appreciate newsletters that include organization and program spotlights, research, program QI, or evidence-based practices, results slash outcomes, and looking to learn from the folks here as I am new to the platform. All information will be helpful. Fantastic. Okay, now we're transitioning to that second portion of regular meetings or events. What type of meetings, events would you like to see? And we have after work networking events, learning sessions on partnership building and collaboration, in-depth updates on programs, policy and funding updates slash learning sessions, or other. And if you select other, please share what it is you're thinking, either in the chat or out loud. Gonna give it another minute or so for folks to get their entries in. Okay, so it looks like so far, folks are most interested in in-depth updates on programs, learning sessions on partnership building and collaboration, followed by policy and funding updates and learning sessions. And then the last option is after work networking events and other. So again, if you selected other, please share either out loud or in the chat. Okay. And again, relating to those meetings and events, how often would you like to attend those events? Monthly, bi-monthly, which is again every other month, quarterly, or ad hoc, so as needed. If we have something interesting to share, then we share it. Going to give you another minute or so to get those in. Okay, so a strong preference for quarterly. We're seeing a little bit of interest in bi-monthly, but quarterly seems to be what people feel like they have capacity for, which is why we're asking. Okay, what specific topics would you like to center these meeting and events around? And this is I think it's going to make a word cloud. So if you want to put just like a word, a phrase, whether it's policy, uh, collaboration opportunities, whatever, unhoused individuals or, uh, you know, whatever you're interested in having these meetings focus on. We'll take another minute or two for folks to put in um, some topics. But looks like policy, collaboration is another big one. Updates, community resources, and community stigma so far. People-centered approach. And all of this is aligning well with our goals and strategies. So that's good to have that alignment already. I'm going to do another 30 seconds or so, and then we'll move on to the next question. We've added, it looks like engagement, professional development. Okay, we're going to move on to the next one. And this one, like the one on the newsletter, is just a broad open question. Any other thoughts you have on meetings and events through systems in sync? Just feel free to share. And this would include what is it you would like to get out of these meetings and events, even if maybe you don't know exactly what topic or whatever you're looking for, but if there's something you'd like to gain from it or that you think would be helpful or that there's a need for in your work. Okay, I'm going to move on to the next question, but feel free if something comes to, oh, wait. The community presentations were very helpful. Tables and collab sessions are always great, but it was nice to see each organization present present with a set amount of time. I felt nothing was missed. Great. So it sounds like between both the newsletter and the events, that spotlights, continuing spotlights or updates on organizations, program collaboration efforts are really something people are interested in. Annual presentation, okay.
Sam, this is Jess, and I just wanted to add also, I think that there was something valuable about when we look at the panel and the presenters, kind of the mix of people from a strategic perspective. It was really helpful to have elected officials and people who are, kind of longstanding leaders of programs and initiatives, as well as people with really deep community and lived expertise, and a range of, people working on youth issues to workforce to research. So that from a strategic perspective, I think is valuable, particularly in kind of having elected officials and big program leads in the same room in conversation with other folks who may not often have access to sort of that level of kind of voice and input.
Thanks for sharing that, Jess. Yes, a big intention behind this was to get folks from across different sectors, different size of organizations, and really reach out to folks who, because I know at a lot of the meetings I'm at, it's a lot of the same people and same organizations. So really trying to cast a wide net and get people that maybe aren't always as connected to the health department or the major organizations like NAMI, and bring everybody together. Okay, and the big question. Would your organization be able to support putting together the newsletter and or events and meetings? You should be asked a few questions. I think just like name, organization, email, and then whether or not you would be able to support either just general support or co-leading one of these efforts. Um, Whatever your organization has capacity to do as far as contributing to this effort. So I'm not doing it just with me and my little team here at IPHI. Mighty, very mighty, but little. And for those of you who are filling this out, we will follow up directly with you to discuss more what type of support you're able to offer um, and how that would actually work. So uh, there will be a follow-up. You're not directly signing up for anything right now. And I will also put my email in the chat. So if after this meeting, you would like, you have questions or would like to discuss in more detail or any other feedback that maybe we aren't covering today, um, you can reach out directly. Although you should all have my email because I know I've been emailing you all the time. Gonna give another minute or two for anyone who's still filling out the form. Okay, I believe this is my last slide. Yeah. So I am going to stop sharing, but I will open the rest of that Menti back up. So if you need to go back and answer something you missed, or if you want to share it with anyone else that isn't at this meeting and you think would want to contribute, um, then you can do that and they can give their opinions as well. Let me get back to our presentation. Okay. Now, just going back to um, our list here, if there's anything you want to share, want to discuss, think we should make sure to note. So if there's something like um, that you think we haven't addressed yet, but we really should be thinking about, for example, Jess's point about the cross-sector involvement, feel free to, again, post in the chat, come off mute, or if it comes to you later, send me an email. And now Zoom is not up. There it goes. Zoom took away my chat. Okay, y'all, we've been flying through this. Next steps. The IPHI team will review the feedback and the survey and today's discussion, as well as the goals for Systems in Sync and the mental health work group and AHE in general and IPHI in general. So a lot of information to take in. And we will come up with a plan to go forward that will probably look roughly like what we've talked about today. And any additional feedback, again, can be sent to me via email. You can check out the Systems in Sync website, which is a page of the IPHI website. We'll share that link again in the chat for any, if you want to see photos and videos from the event. Any other updates will also be posted there. We will be emailing out the slide deck and notes and recording from this to you all, as well as everyone who attended the event and our whole mental health work group. So hopefully I won't email some of you like 3 times. I'm going to try to avoid that. And then once we have our finalized plan, we will present that to the Alliance for Health Equity Mental Health Work Group at our meeting next week on the 14th. If you are interested in joining and aren't already a part of the mental health work group, just shoot me an email and we can get you that event invite. And then once finalized, the plan will be shared with all systems. Oh, as I already mentioned that. And yeah, keep working on those partnerships. As if there's a way we here at IPHI can help support your partnerships and collaborations while we're building out our plan going forward, please let us know. If you're looking for a partner that's a specific type of organization, that'll all go in the newsletter, but the newsletter probably won't start up for a little bit. So we're happy to be that connector and try and find someone to match your needs. And to close with a wonderful quote from Shelley Lustrup, the CEO of our partner NAMI Metro Suburban. When we lead with connection, compassion, and partnership, we create pathways to healing that no one system can build on its own. So thank you everyone for participating today. I hope you know we really appreciate all of your feedback and support, and we'll definitely be in touch soon with our next steps.